Young dyspneic female patient of short height and thin build is lying on the bed having cyanosis and clubbing of the fingers. The pulse rate is 90 beats per minute. It is of normal rhythm, volume and character. The blood pressure is 100 by 70 millimeter of mercury. The JVP is not raised. There is no pedal edema. On examination of the pericardium, there is no scar, bulging or deformity. The apex beat is undisplaced with normal character. There is a left parasternal heave and a systolic thrill present at the pulmonary area. On auscultation, the first heart sound is normal and pulmonary component of second heart sound is soft or absent. Or the first heart sound is normal and single aortic second heart sound is audible. There is an ejection systolic murmur present at the pulmonary area which becomes louder during the inspiration and it radiates towards the neck. The lung fields are clear to auscultation. There are no signs of the pulmonary hypertension.